Good afternoon, everyone, and welcome to Open Classroom. This is Janet Gillow. I'm the Director of Professional Development at the Brown School. We are so delighted you are here joining us in our virtual classroom as we cannot currently host you in our physical space, but we hope you're healthy and safe wherever you are. Before getting started with today's programs, I just want to give you a couple notes about what we have coming up. This is a special week for Open Classroom because we have two programs we're doing in co-sponsorship with other units of the Brown School. So tomorrow, which is not a normal day for us, but Wednesday at 4 p.m., we're partnering with the Center for Mental Health Services Research. Dr. Leo Cabasa is giving a program called Effectiveness of a Peer-Led Healthy Lifestyle Intervention for People with Serious Mental Illness. So if you're a clinician with interest in severe mental illness, you'll definitely want to check that one out. And then we're back in our standard time slot on Thursday at 12:30 p.m. Central, partnering with the Catherine M. Booter Center for Native American Studies. Lindsay Manchak is going to be delivering a program on the 2020 census with the implication for Native communities. So that will also be really interesting, so important, the census this year. With those program notes in mind, I'm now going to pass the program over to our Associate Dean for External Affairs, Gary Parker.
Thank you, Janet, and thank you all for joining us today. Janet, you have done such an amazing job bringing together some programming over the last several weeks, and I know that I, not only on behalf of the Brown School for your work, kind of featuring our superstar faculty, but also from the members of the community who have been sending all kinds of wonderful notes to us, just expressing their gratitude and enjoyment of the program. And I don't think that today's program any exception to that rule. We're going to talk about finding and using big data from home. And for that, there's no better researcher to talk to than Professor Brett Drake. He researches matters of child welfare with a focus on early intervention cases of child neglect, as well as the connection between socio-environmental conditions and child neglect. His current research analyzes census and child protective data the efficacy of protective and preventative services. His research and his many years of child welfare practice at the direct and clinical levels inform the master's level courses that he teaches at the Brown School, and the topics of his classes range from diversity in human behavior to analysis of practice. In addition, Drake teaches doctoral classes on research methodology, and due to his interest in philosophical and theoretical aspects of social work research. He also consults with a number of state and local agencies regarding evaluation and administrative data. And Janet and I got a little bit of a preview of some of his slides before you all arrived today. So we can tell you firsthand, we're in for a real treat today. Thank you so much.
Great, thank you. So what I'm going to do today is I'm going to talk about getting big data and using it yourself. So this is very much meant to be kind of a workshop sort of format. I am not going to be telling you about the research that I've been doing. I'm going to be walking you through some things so that you hopefully will have the ability to do these things yourself. As said, my background is mostly using very large data sets, millions and millions of records. And you'd be surprised, you can access also very large data sets with millions of records. You can do it free, and you can do important work based on it. You can also find big data sources in other ways. You can go to any number of sites around the country that'll manage the big data for you online and print out little summaries or reports. So some of what we're going to be talking about is going to kind of show you some of the kind of detailed craftsmanship, like, you know, this guy's got like 30 chisels, right? You know, he's really hardcore. But some of what we're going to be talking about is going to be at a much more basic level. So I'm trying to set up this presentation so that really, no matter who you are, hopefully there'll be some fun stuff for you. Okay. One of the things that surprised me about this field is there's not really a clear definition of what big data is. For me, big data just basically means a really big Excel spreadsheet. And hopefully it means several really big Excel spreadsheets that you can interlink with each other, multiplying what you can do with those data. So So for me, big data is just big data. The good news is that a lot of states and counties are moving to formats where you guys can get this data either in raw form or in managed form. So there are literally thousands of these sites. I don't know the vast majority of them. And you'll find that if you start looking into this for you, that you'll begin to become an expert in your area. So if you're into adult protection, you'll find one set. If you're into domestic violence, you'll find a different set. So part of this is just sort of learning what's out there and what you can get. And we'll talk more about that right at the end. So we're gonna do three things today. What I originally wanted to do with you was to go through an actual live big data analysis where I would just go to a website, pull down the data, do some programming, take it to Excel, make some graphs, and kind of show you the whole process live. I'm actually not doing that because it turns out that's difficult to do in this Zoom format. But what I am going to do is show you three different things. One is very simple, and it just involves answering actually a question that my wife asked me. Then we're going to use something called the MICA system here in Missouri. Now, if you're not in Missouri, there's a very good chance that your state has a similar system. You need to see if that exists. So for us in Missouri, we have this wonderful MICA system. And then I'm going to walk you through a more detailed project using some legit big data, using hundreds of thousands of records that I downloaded from New Orleans. And we're going to try and build as much of this as possible around the COVID pandemic, because I thought that would be interesting for people. And because that's my way of saying to you, wow, this stuff is live. This is not something done 10 years ago. This is now. And I think that's really exciting. Okay, so we're going to do a real simple thing first. So last week, my wife asked me a question. She said, do you think more people are getting interested in cooking because of the pandemic? I happened to be on my computer at the time. So I remembered that there was some kind of thing where you could track how many people are looking for stuff on Google, but I didn't remember what it was called. So I put in Google Searches Tracker, and I got this thing called Google Trends, and I just hit that button. By the way, throughout today's talk, I'm going to be showing you screen for screen for screen. I am not going to jump over stuff. I'm going to show you exactly how these processes work. So I went to Google Trends, and this comes up. So apparently, people are interested in Taylor Swift, Kim Kardashian, the World Cup, and football. But my wife was asking me a question about cooking. So I didn't even think about it. I just typed in cooking. And I'm not quite sure what all that stuff, topic, search term means, but I just hit enter because it was fast and easy. And I got a picture. So it took me a second to try and figure out what was going on here. So the way this picture works is the bottom are dates. So this goes up to like almost now, and it goes back to May of 2019. And then the line gets higher when there's more searches. So the 100 means that was the busiest day for looking for cooking, and it was 100%, so they call it, you know, that day. And the other days are less. So the average day is about 30% of the highest days. So I'm like, dude, that looks weird. What's with those Batman ears? What is that about? And then I'm like, you know, whoa, look at that. It looks like right at the end there, it's kind of going up, and it looks like there's a bump. So I'm like, you know, I need to figure this out. So you guys have probably figured this out already. If you look at the dates, you know right away where those two Batman ears come from. One of them is Christmas, and one of them is Thanksgiving. So that makes sense. That's pretty good. And it also tells me right away, look out, Brett, there might be unexpected things in these data that you're not expecting to see. And I was wondering about that other little bump on the right. Maybe that's Easter Sunday, right? I don't know. So what I did is I hit past 12 months, 90 days, and I got this picture. Okay, now stuff is happening here. And one of the things I noticed is that if I rolled my cursor over the blue line, it would tell me exactly what day it was. So that was pretty cool. So there's a lot of stuff going on here. I noticed that there was a big spike, and that was Easter, right? April 12th. And then I noticed that there were all these little shark teeth. And like, what's with that? Every one of those shark teeth goes up on a Saturday and peaks on a Sunday. So it looks like more people are Googling the word cooking on weekends. And it's kind of Norman Rockwell-y. It looks like people are like having Sunday dinner and like making a big deal out of it. And I didn't know that still happened, and that's kind of cool. And then there was this broken tooth where the black arrow is. And I'm like, dude, what's that? And that was St. Patrick's Day. So St. Patrick's Day kind of messed with people's grooves a little bit and screwed up the pattern. So I noticed some of that stuff, but I didn't answer my wife's question. So let's do that. So if you break this table down into pre and post COVID, you can see that before COVID, the weekday average was about 26% a peak. And after COVID, the weekday average was about 38% a peak. What this means is that after COVID hit, the number of Google searches for cooking went up by about 50%. So I said to my wife, I said, hey, yeah, you're right. There are about half again as many searches for cooking since the COVID thing hit. So what do we know for sure? Well, we don't really know people are more interested in cooking, but we do know for sure that they are doing more Google searches for cooking. And that's what this big data can give us. And it's not definitive, but it's better than knowing nothing. So why did I drag you through that? I wanted to make some points. The big data are out there. You can get them to them. And sometimes it's insanely easy to do this. The fourth point is really important. One of the things about collecting your own data is that nobody has sanitized it for you. There could be weirdnesses in the data and you have to protect yourself. So you need to look at your data and go, oh, is that right? Does that make sense? Is this sane? Is this wrong? Is there something weird that's going on here? So you need to think critically about the data. So that's why we had those weird teeth and stuff. And point 5, once you get into big data, all my students in my data management classes tell me this. It's like you start like, oh, that's fun. And you start going down these crazy rabbit holes and just kind of surfing around and looking at stuff. So that's kind of a problem. But the other thing I'd like to say is, I think this stuff is just plain fun to do. And I think if you're able to get into it a little, you'll enjoy yourself. So for me, there's kind of a social justice philosophical side of that. And that is that if you can access the data yourself, you're really free. You don't have to rely on some professor like me to tell you what he thinks and to stuff all of my biases down your throat. You can just look at the data yourself and make up your own mind, and you can look at it different ways, and you can be the boss of you. And I think that's really cool. We were told in school the printing press changed the world because it meant everybody could read things for themselves and wouldn't have to just believe what authority figures told them. I think the age of big data is really exciting because now you don't even have to believe what the author of the book said. Now you can go look at the facts yourself. And I think this has really powerful implications for the citizenry of a nation taking more control over their nation. This manifests itself in a lot of very direct ways. For example, there's a lot of organizations pushing law enforcement to put a lot more of their data online. Because if you can look at their data just as well as they can, it's a lot easier to hold them accountable. And so I'm very excited about this, not just as a data geek, but also as a social worker and as someone who's committed to making our world a fairer place. Okay, now we're going to do a real, more hardcore example. Let's say you work in an agency and your job is to make sure that women get prenatal care, because there's a bunch of women out there who aren't getting prenatal care, and your job is to make it better for them. So let's say you're applying for money, or you're doing a report to the United Way, or you're trying to get someone to be a donor or something. What we typically do is we say stuff like, everyone knows this is important, and we kind of tend to be a little light on the charts and graphs sometimes, although some of your agencies out there do a magnificent job. But then when you start thinking about this, what do you really know about the people you're trying to serve? And could you know more about them? Well, you could look at a report or an article that some guy like me wrote, but it's probably old and it's definitely not about the place you serve. Maybe there's some websites up for the city or whatever, but again, they may not be just what you need. What you need is data on your people you're serving right now. And this is how you can get it for some things in the state of Missouri. So this is my second example. There's something called Missouri Information for Community Assessment. And I never remember where web pages are. I just always Google everything. So I put in MICA Mo. If you don't put the Mo in, you get the medal. I put in MICA Mo and I got this MoFilms thing. So I hit that. And this is the MoFilms page. And right in the middle there is MICA. So I hit that. And then this is MICA. And there's a bunch of different kinds of data. There's more off the bottom of the screen. It's amazing. You want to know how many gunshot wounds there were in 63130 last year? It's in there. It's just amazing. So I went into the birth MICA. And I had to make probably a dozen clicks to get what I wanted. The first arrow on top shows that I picked last year, or the last available year, 2018. So this data is a bit laggy. That's not good. And then I selected all the zip codes in Missouri. And I wanted to know about prenatal care beginning in the first trimester. And then I scrolled down on the screen and I got to a couple more options. I told them that I wanted the rows, the left side of my Excel spreadsheet to be zip codes, that's geography. And I told them I wanted the columns of my spreadsheet to be statistics, and I hit the go button. And this is what it printed out. So that's all I had to do to access these data from the state of Missouri live in the way I wanted. So let's say that my agency is serving north central city of St. Louis, and it's particularly interested in 06, 07, and 113. Those are some extremely highly impacted zip codes in St. Louis. So I can actually look and see how many women are receiving prenatal care during the first trimester in those zip codes. And if you scroll all the way to the bottom, you'll see the rate for Missouri is 71%. Well, my zip codes are in the 40s and 50s. So I got some work to do. My zip codes aren't getting the first trimester care that they should be getting. And now I know this. I'm not guessing. So I can make a nice little chart to sort of say, hey, look how much my agency needs your support, or look at how much work we have to do, or this is why you should give me this renewal grant. This is all just the same data. I just put it into a Excel graph just to kind of make it pop a little bit. I thought that was kind of cool. And I referenced at the bottom where I got my data. Now, that's all cool, but I'm going to show you something a little bit more complicated. You might not just want to know how many women you need to serve. You might want to know which women you need to serve. So what we're going to do here is we're going to pick the last 8 years so that we have a bigger sample. We're going to look at our 3 zip codes over here on the right, and we're going to look at something called the Kotelchuk Index. I just did this to switch things up. The Kotelchuk Index is a way that physicians categorize whether or not your prenatal care for your kid was good enough. So it's adequate, not adequate. So we're going to look at that, and then we are also going to look at the age dimension. There's another button you can push that allows you to select for age. So now we're in our 3 zip codes up here combined. We're looking at an 8-year span. And these are the rates of adequate prenatal care by the age of the women in our neighborhoods. So as you can see, the people who are most inadequate in their prenatal care, unsurprisingly, are the late teens. They're the ones having the most trouble. Surprisingly to me, there's also a little kick up right at the end here. The older mothers are also having a little trouble. So what this is telling me is something I already knew maybe, but didn't have proof of. And that is, if I'm going to serve women in these 3 zip codes, and I'm going to try and get them to do better prenatal care, maybe I want to focus not just on young women, but on women who are technically minors. So this is a big deal. Is my agency set up to do that? Can we interact with people who aren't adults? How is this going to work for us? So by using big data to look at the people you serve, you can start to have policies and practices that are based on evidence and data, not based on assumptions and guesses. So I think this is an accountable way to do excellent practice. And it's out there. It's just waiting for you to use. So I'm a big fan of this. Okay. Now we're going to go a little bit further down the road. Let's say that you set up your agency 5 years ago, and the goal of your agency was to increase prenatal care among women in those 3 zip codes, because that's the area you serve. You could actually use this as an evaluative mechanism for your agency. You could run a graph showing how this is changing over time within those 3 zip codes. And if you're lucky and you're doing a good job, maybe those rates will be getting better over that time frame. You can actually do a program evaluation suggesting that you're having an impact. So this is pretty cool. It isn't just for understanding who you serve. You can even use this to evaluate whether your agency is being effective or not. I've worked with some agencies that provide foster care services, and they actually go a little better than this. One of the things they've been able to do is they get on the phone to the state. They say, can we send you the identifiers of our kids that we're doing foster care for you for? And can you tell us what their success rate is of staying in their foster placements? And the state will send them that data back, and they can use these data from the state for their own internal evaluations. It's pretty exciting. It means that they can do a pretty effective and low cost evaluation plan. Now okay, I'm making a lot of promises here, and I'm saying that you can do basically anything with this data. That's not really true. What you can do is you can take advantage of the data that are out there as best you can take advantage of them. Quite often you'll want to do something and the data simply won't exist or won't be the right kind of data to do what you want to do. So I'm not telling you that you all have a complete, perfect path forward using these data. I'm saying that you might, and that there could be things that are useful, and that it's worth checking out. So I think this stuff is pretty cool. And now what I'd like to do actually is to kind of go all the way with you and do a big time number crunch. You notice up till now, we've been relying on Google or the state to kind of give us the numbers. They've been crunching the numbers for us. Now we're going to crunch the numbers from ourselves. We're going to suck up some raw data and we're going to do big time number crunching. Okay. So I decided on this question because I thought you guys would think a COVID question would be fun. And because I was kind of wondering about it. And so I thought, hey, let's go. So my general question is sort of what's up with crime? You know, people, I keep hearing, oh, it's getting better, it's getting worse. I don't know. I've never seen any real data on it. So I thought, well, let's go look at the data. So, hey, is there a change in the numbers of calls to police before and after the COVID lockdown? So I'm not really able to answer what's up with crime, but at least I can say, are calls to the police for help changing? I can do that. How can I do that? Well, I can find some data. So there's this big organization called the Police Data Initiative, and they will tell you which places have available data, but most of them won't work for me because most of them are either like updated as of the end of the year. That won't help me. Or they don't have good information on what kind of call it was. San Diego has great data, but they actually take out a lot of the interesting data. Things like interpersonal violence and child maltreatment are all taken out of their data for confidentiality reasons. So I had to look through a bunch of these before I found a data set that would work for me. So New Orleans, Louisiana, NOLA, does work. And they had their data up through March 31st. But end of last week, I'm doing this presentation and I check them again, and they're not up through March 31st. They're up through May 15th. They're up through last week. I'm going to be giving you data from like last Wednesday. This is like amazing stuff. And so I thought, cool. So now I can ask even better questions. And the take home here is stuff changes all the time, and it's getting better all the time. Okay, new research questions. Was there a change in the rates of different kinds of calls for service in the 9 weeks of the lockdown in New Orleans? That's from like March 10th to now, as compared to the prior 9 weeks. And then let's look at the 2019 data too, just for a comparison. So let's have a look at that. So how do I find this? Well, I just Google it. You probably noticed by now, I don't keep notes or anything. I just Google the heck out of everything, and it works good for me. So I am putting in NOLA calls for service. Yeah, I said the word Google. Now my phone's talking to me. So I put in NOLA calls for service, and there it is right there. So I clicked that, and it got me to this page. So I clicked export, and I clicked CSV. Now CSV is a magic word that you might want to know. It means comma separated values. It's, I think, the easiest and most basic way to get data off the internet. And it tends to work good for me. So I said, yeah, let's do that. So I hit that CSV button, and then I waited for like 45 seconds, and it pulled up an Excel spreadsheet of what I had just downloaded automatically without me even telling it. Now, it might save yours onto your computer somewhere, and you may have to go there with Excel and open it. But in any case, mine opened automatically, and it looked like this. Okay, so admittedly, that was pretty scary. Let's go back and look at that again. Okay, I'm scared. What do I see? I see words that don't make sense over here that are cut off. I see weird hashtag things that don't make any sense. I see a lot of fields like beat 1H02, type 94F. I don't understand any of this stuff. Scary stuff. But what we're going to do is we're going to find our happy place. We're going to do some mantras, and we're going to look at it with a calm mind, and we're going to see that we only really want 3 of these rows. Now, the reason those hashtags are there is just because it was too big for Excel to fit in the column. Those aren't really hashtags. So all I did is I got rid of the extra rows, and I widened things out, and it looked like this. So I'm like, okay, I can hang with this. And so the first thing I did is I looked at these data and I said, these data are bad because they're crazy. It's impossible. There's no way in heck that almost every call into New Orleans is discharging a firearm or fireworks. That's crazy. And then I looked at the time created. See when this data set starts? It starts at midnight on New Year's. And so of course, all the calls into police are going to be fireworks and discharging firearm. That actually makes sense. So I'm like, okay. So then I go down and I check a ways down the screen, and then things get normal again. You got kind of like normal calls for service. So I'm like, okay, this is another important lesson. Whenever you're reviewing a big data set, never rely on the beginning or the end because you don't know how it's sorted. Some of these data sets are sorted like with all the missing data at the top. So if you just look at your screen, everything's going to be missing. And you're going to be like, I can't do this. This is crap. But in reality, you're just looking at the first 1/10000000th of 1%. And so you got to look at the whole data set. What I usually do is I look at the beginning, I look at the middle, I look at the end, and then I get a sense for what's going on. So don't be scared away by data that looks bad just because you're looking at the wrong part of it. Okay. I also pulled down the 2019 data because I wanted to do comparisons. Because one of my problems in my question is COVID hit right about the same time as Mardi Gras, right? So you might look at anything I find and say, well, Brett, you're just wrong. That ain't COVID, that's Mardi Gras. Like maybe New Orleans is in a 2-month hangover after Mardi Gras every year. So I'm like, if I pull down the 2019 data too, I can answer that question. So I loaded this stuff into SAS, which is my favorite program. We're going to talk about programs a little bit later. SAS is an old user hostile, but very powerful program that I use. It's very good for data management. And I think it's good for big data because a lot of big data comes from big things like companies and nations and states. And a lot of those have legacy systems that use SAS. So I like SAS for big data programming. R is very popular. We'll talk about R a little bit later. Okay, so I did some stuff. First, I converted the time frame to something I could hang with. Next, there were just so many calls. I didn't know what to do with them. There were like all these different reasons that a call could come into the police. So what I did is I read through all those call types and I took notes as to which ones I thought fit into different categories. Now, this warning is important. I am not a criminologist. I really don't know what I'm doing here in kind of a deep academic sense, okay? The only reason I'm doing this at all is because I thought this would be a cool thing to show you. I thought you'd be interested in this subject matter. So, you know, this is not getting published in Science tomorrow. You know, we are not going anywhere with this. This is just so you and me can sit down together and have some fun, okay? Okay. So I came up with some categories that I thought made sense. Violent crime, property crime, substance abuse, either alcohol or drugs, traffic. There were a lot of those. There were these things called checks that I'd never heard of or thought about, but a lot of the calls for service are actually generated by the police themselves. They'll like call and say, you know, I'm going to go check out the Walmart, you know, on 15th Street, make sure everything's okay, you know, and they'll kind of drive around the Walmart or whatever, make sure it's okay. And they log that as a business check or an area check. So there were a lot of those, and I thought those were interesting. And then one of the things I keep hearing on like CNN are people speculating about suicide rates, about whether they're going up or down or whatever. So my suicide numbers are if the police got a call saying someone's killed themselves, someone's, you know, maybe attempting to kill themselves, or someone's, you know, threatening suicide. If they did those things, and if the police found about it, it's in these data. Okay. Big data is an open palette. It's any color you want. It's any issue you want. You're free. You can do anything you want. You can focus narrowly on one particular issue. You can be broad. You can do it differently. You can do anything. So I just did this, and I'll show you what I did. Okay. I promise this won't take more than a minute. I'm going to show you my SAS code because I want to show you that it's not crazy long. This loads my CSV files. This makes up some nice time variables for me. This improves those time variables so that I can look at weeks. This A, B, C, D thing is the first, second, third, fourth week of each month. So you'll see that in a minute. So just so it's easy to sort of read. This is text mining. You've probably heard of text mining. Text mining is just looking at the English language on a computer and seeing if certain words show up or how they show up in relation to other words. This is the easiest way to do it. I just looked for particular stuff. So for example, if looking at traffic, if the words vehicle or boat or auto accident or hit and run or reckless driving showed up, then I called it a traffic accident. And this was based on my review of the data. And then I had some code that counted it up and gave us pretty totals. And that's it. That's the entire SAS program I wrote. So I downloaded this data and programmed it in under an hour. Okay, so you can do this amazingly fast. Okay, then what I did is I took my SAS output and I threw it back into Excel. Now you don't have to do this. You can create tables and graphs and stuff in SAS, although they're not very good. Now, if you're an R person, that writes some crazy impressive tables and graphs and stuff. So R is really, really, really good for this, but I'm not an R person. So I used Excel because I like Excel. So here's some of our main findings, okay? Now, the two lines are showing you when the second week in March is. The red line is the second week in March of this year. That's when New Orleans went into lockdown. The yellow line is the same date in 2019. Well, why do we care? Because showing you the 2019 data and how things worked shows you that in 2019, it kind of stayed stable before and after that date, right? In fact, you see how there's some little spikes right before the date in both data sets? That's probably Mardi Gras. But in any case, if we look at 2019, we see that after that little bump, things stabilized pretty quickly. Now, if we look over here, they don't stabilize. So let's just kind of look at these are the total reports. If you just look at the total reports, nothing much is happening. So you say, how many calls were to the police? Well, it doesn't change much. But if you look at the checks, like the area checks and the residence checks, those went way up. Why? Well, I have a theory about that, and I'll get to it in a second. Some stuff tanked. Look at traffic accidents. The rate, this is the rate, by the way, this column over here is the rate of calls per week, and each one of these is 1 week. So this is 2020, second month, February, first week. This is 2020. There's actually one thing for every week, but Excel couldn't fit them in, so it's just showing us every second week. So this is 2020, March, first week, right here, okay? And then right now, we're in 2020, May, first week, and then you are right here. This is our time right now during this talk, okay? So what happened to this traffic line? It tanked. During the lockdown, the number of traffic calls to police just went right down. That makes sense. Let's look at violent crime. Maybe it's going down a little bit, kind of hard to tell. Suicide, I'm afraid you can't see suicide because it's way down here and it's hard to look at. We'll show you that in a different way though in just a second. So what it looks like in the data is that after COVID, traffic went way down. Gray, property crime looks like it went down, and maybe some other things went down. So I'm going to show you another picture that shows these data in another way. I call this my Christmas table. So the green bars are what happened in 2019 in the 9 weeks before March 10th and the 9 weeks after March 10th. So as you can see in 2019, about the same for substance abuse, about the same for checks, about the same for property crime, about the same for traffic, about the same for violent crime, about the same for suicide, about the same for total calls. So in 2019, during this same period, nothing much changed. The red lines are 2020. The blood red is pre-COVID and the cherry red is after COVID. So maybe substance went down a little, not much, not really. I'm not excited. The checks went crazy. Okay, that's a difference, right? Property crime, strangely enough, went up from last year to begin with, but it dropped a lot during COVID. Traffic just tanked during COVID. And what about these things? You know, maybe violent crime went down, maybe suicide went down, kind of looks like they did, but even if they did, it's not a lot. And I'm not really confident about it, and I'm certainly not jumping up and down in my seat saying, oh, look, I found something, okay? These three, I think, are real. These two, I don't know, maybe. So one of the things that you can do is you can have like a bottom line. So this is the whole study in one simple picture. Substance abuse looks like it went down a little. The checks went way up. Property crime went down a third. Traffic went down by half. And violent crime and suicide went down by about 1/6. But I don't know if that's enough to make it a real change or not. So that's how you can get into some big data and manage hundreds of thousands of records and come out with some answers that kind of make sense. Okay, this isn't really a homework assignment, but I just want to say you could do better stuff than I did. Like, let's say you want to know, we keep hearing COVID is impacting poor communities more. Well, you can check that. How do you do it? There's no money information in the calls for service, but there are zip codes. So you can link this to census data and you can add the community income to the calls for service data. And now you can do an analysis and see if those lines look different when you maybe just look at poor communities, or maybe you just look at predominantly minority communities. So you can start doing some real social justice type stuff here. It's pretty easy. Pretty cool stuff, I think. Okay, some notes on finding data. This is probably the most important slide. You need to educate yourself about what's in your area because I can't tell you. Now, if you want to know about child abuse, you can call me and we can talk. But apart from that, you're just going to need to find out. Department of Elementary and Secondary Education has a lot of good stuff. City of St. Louis Open Data has good stuff. There's a lot of federal stuff like Uniform Crime Reports or the National Vital Statistics System. Believe it or not, all births are individual lines in a big record you can just download. Now, it doesn't have your name on it or anything like that. It's all de-identified. But you can look at every birth in the United States last year if you want to. And there's cool clearinghouses. So pick an area, look around, see what you can find. Some notes on analysis. You can do some of this in Excel. R is free. R is a big up and coming package. A lot of people love it. Python up and coming. There's often ways to kind of get cheap versions of programs, and you can totally just train the heck out of yourself by using YouTube and available tutorials and PowerPoints. It's the 21st century, guys. All this stuff is online. They'll teach you how to do it. Now, none of this is as good as the stuff that Washington University offers in its ongoing educational series. It's second rate compared to WashU stuff. But there is some stuff online you can find only after checking that WashU isn't offering it. Okay, very important first step. Okay, final notes. Stones, not Spice Girls. You can't go to big data and get what you want, what you really, really want, because you're just not going to find exactly what you're looking for. It is not Spice Girls. It's the Rolling Stones. If you try sometimes, you just might find that you get what you need, okay? So that's kind of a philosophy that you're going to have. Another cool thing about big data is you can triangulate using different sources. You may be like, Brett, I just think your data is garbage. And I'm like, okay, let's go look at Chicago and see if they found the same thing. Or I can say, okay, fine. I think violent crime is going down. To hell with police records. We're going to go to emergency room records and we're going to see if gunshot wounds drop. So there are lots of choices to triangulate. And the more different viewpoints you get, the more faith you can have. So that's pretty cool. Any universal data set can be merged to any other universal data set, particularly at the geographic level. So you can look at uniform crime reports for a city, or you can look at CDC opiate abuse rates for a city, or you can look at infant mortality. You can do anything you want. You can put all these different data sets together and you can party. So that's pretty cool. The other thing is big data are great for time analyses because a lot of them come in times. We keep hearing like when it gets hot, everyone like murders everybody, right? That we all get irritated and do violent crimes. I don't know if that's true or not, but I know how to find out. If you give me 3 hours, I can pull the data down from the Uniform Crime Reports and the National Oceanic and Atmospheric Association, and I can merge them together, and I can tell you whether or not there's more crimes in cities when the days are hot. So you can do time analyses that are pretty cool using big data too. So I was told to talk for half an hour to 45 minutes. So that's me talking for half an hour to 45 minutes. And I'll turn it back to our moderator.
Brett, that was sensational. I can't tell you how much I enjoyed that and how much I can't wait to get off of this webinar and try some of this myself. You really took us through it in such a really fantastic way. And there are all kinds. I'm going to hand it over to Janet to ask the question, a lot of them.
Yeah, Brett, thank you so much. That was informative and entertaining, and the feedback on the chat is so appreciative. People had a good time with what you were presenting, which not often is said, I think, when we see SAS programming, but there you go. So I'm going to lead off with a question from Jim. He absolutely sees the opportunity and the excitement around the availability of big data, but he's wondering a bit about the dangers. Conspiracy theory stuff, also kind of the death of expertise if everyone is an expert, possibly making wrong assumptions. What commentary would you offer on that?
Well, I'd say two things. As a citizen, I'd say the more voices we have, the better, and we're just going to have to tolerate some crazy people. As a scientist, I'm going to say one of my scientific heroes is a guy named Steven Pinker from Harvard. He's a well-known sociologist, and he's all into doing what he calls sanity checks. So Steve says, never trust any data until the data has proven itself to you. So for example, I happen to know that in child abuse and neglect, there's a close correlation between risk of maltreatment and poverty. So anytime I look at any kind of data set that has child maltreatment data in it, one of the things I do is I check the relationship between income and maltreatment. And if it's not there, I don't trust the data. Another thing I check is like sexual abuse rate between boys and girls. It should be much higher for girls than it is for boys. If it isn't there, I don't trust the data. Another thing I do is I know that child maltreatment rates have actually been dropping since the mid-90s. So I'll look at that. I know that's real. If it's not in the data, I don't trust the data. So, I mean, this was a pretty fast presentation, but I only look at data, except now, that are in my area that I actually know something about. And I take it upon myself to really check that data. So I make it convince me that it's worthy of looking at. And again, triangulate. You get this data set, you see what it has to say, you get the most different data set you can think of, and you see if they agree with each other. Like a classic example of this is police reports of violent crime. If I just see police reports, they could be subject to all kinds of bias. So what I'm going to want to do is go get like gunshot wound records. And if they're very different, I'm like, uh-oh, one of these data sets is screwed up. But if they agree with each other, if they're like on the same page, then I'm like, hey, I feel better about this. But, you know, dude's right. At the end of the day, you know, if you're not a good scientist, you can like be a child in a China store and do a lot of damage. But for me, I want the freedom to see and hear and evaluate that. I don't want someone else telling me what's real.
So you're raising a really interesting point, Brett, which is that there's no really one go-to source for data information, that you really need to try to go to different sources and triangulate, you know, in order to get the full picture when you're testing any kind of assumption.
Yeah. And I think you also need to forget about looking for small effects, because the different data sets and the different kinds of error in different data sets, this one will say, oh, it's 2% more. And this one will say, oh, it's 2% less. No. We're going to be looking for 20% plus size effects. We want the effect size to be so strong that it's going to burn through any kind of variability between the data sources. So in my view, you need to be looking for big game here. It's like maybe your glasses are a little dirty, so you can't be hunting mice. You got to be hunting elephants, because you're going to see that elephant even through your dirty glasses.
So I want to just, Valerie has a question. She said, when you looked at the pre and post, the crystal graph, did the numbers you look at for 2019, did you use the whole year or just the March to May?
No, I used March to, for both comparisons, I used the 9 weeks leading up to March 10th, and then I used the 9 weeks after March 10th. So it was January 1st to actually to March 7th. January 1st to March 7th, both years, compared to March 8th to May 14th, both years.
So you did that so that you could understand really pre and post COVID, right? Because Valerie's just making the comment, like if you'd looked at the holidays, there might have been another spike.
Right. Don't care. Just wanted to look at the COVID thing itself. So I had two ways of seeing if it was really COVID. One was when COVID started, did things change? And the other way was last year, did that change happen? And the answers are yes, it changed this year, and no, it did not change last year. So that makes, because like I said, for all I know, New Orleans goes into a 2-month hangover after Mardi Gras, right? You know, so maybe that's just the after Mardi Gras effect, right? But it ain't, because it didn't happen last year.
Yeah.
Great. So you have a personal greeting from Emily Beck, who was formerly a staff member at the school, just wanting to tell you hi. And then there's some questions about reliability in data. I'll lead with the first one. Sal is particularly interested in reliable data related to race, ethnicity, and opioid use. Have you encountered any data sets, or do you have any guidance for where he might begin his hunt?
Yeah, okay. I know some people who are doing this. I haven't done it myself, but I can tell you what they're doing, and hopefully they're not online screaming it, no, don't tell them, I haven't published yet. Okay, so CDC has all kinds of information available on opiate use and prescriptions and other stuff. And so this is a little bit tricky. This is where we're going to go Rolling Stones on you, okay? What you'd like is, oh, here's Bob. He's black. This is his history, right? No. What you can get is you can get geographic data. So you can look at different parts of the country and see what their opiate experience looks like, right? So that's pretty cool. But then you can mix it together with census data showing you the economic and racial structure of those areas. So maybe there is a data set you can go to. Maybe BRFIS does this, the Behavioral Risk Factor Surveillance System. That's 400,000 records a year. That might work. Yay, that's a sample data set. The other thing you can do is you can go to CDC's Wonder, it's spelled something like, you'll find it, and you can try and see geographically. You're not asking, are there different experiences for black people and white people and Latinx people? You're asking, are there different experiences in black areas and white areas and Latinx areas? But you probably could do that. In fact, I know someone who is doing that.
Are there any other particular data sets that you enjoy kind of diving deeply into and kind of exploring, or do you always go with the question first and then find the appropriate data question?
Oh, that is such an unfair question. As a good scientist, I always have a theoretically justified question, and I never just look at data and say, oh my God, this is so fun, I've got to do this. Of course, I mean, yeah, I do that all the time. Okay, so this is actually a really good philosophical question, because in the old days, we used to say, have your theory, have your idea, set up your study, do your study. But that was when we had to do every data collection thing as we moved along. I don't believe that's the way to go anymore. Well, you can do it that way. I think the way to go is, here's what's out there. Here's what I think is cool. But most importantly, here's what America needs to know. And I think what you do is you find the place that fits all three of those things so that you can make it happen. So for me, the big way to use big data, I always imagine a senator standing up, you know, in his big plush chair saying, "You tell me, son, what have you done that justifies the money we've been spending on your university?" And then I would say something like, well, you know, I've looked at the transaxial coaxis between the ABC model and Bonson's, you know, 3-level model. And he's going to say, son, are you telling me my constituents are paying money for that? And so I have this idea in my head. So I want to be able to say something to the senator like, Senator, I found that there really is more maltreatment in poor neighborhoods. And I can show that to you a lot of different ways. It's not just because they're more likely to be picked up. It's because those kids are really more at risk of dying or being hurt. And I can tell you that for sure now, Senator. So I want to be able to do research where I can tell someone something real and simple and clear. So for me, that's my main guidance, is what do people want to know and need to know that we don't know? And how can I use big data in a scientifically responsible way to answer those critical questions?
That was great. I think that's the only time I've ever laughed while somebody was talking about child abuse. So we have a question about with big data sets, wondering, is the reliability dependent on what is collected and how it's collected?
Oh, absolutely.
And of course, you may not have visibility into that. So anything you want to share about that?
It's partly a black box, and you're stuck with that. But hey, we've been pretending for 100 years that survey research isn't a black box, and that's just baloney. I mean, you don't know why people answer the questions the way they do. You don't know what people remember. And you're like, oh, I'm doing survey research. I've got an 80% response rate. And you're like all happy, right? And then big data comes in and you're like, oh, 4% of those data could be wrong. And that's just hypocrisy, right? So yeah, you're right. There's black boxes and there's limitations and there's bad data in big data. Absolutely true. But it ain't that different from traditional forms of social research in my view. And one of the ways I evaluate this is I look at the findings from big data and I see how consistent they are. And they tend to be consistent even when they come from different sources. If you look at survey research and you see how consistent they are, in my field at least, the big data is more consistent than the survey research. And so that's suggesting to me that maybe we have something to add. Now, you're hearing me say, survey research sucks, don't do it. No, 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 no. What I'm really saying is, if we have survey research that's like a lizard, and we have big data research that's like a bird, and they're coming to the same conclusion, that's the best thing we could possibly have. I am desperate for people to do good quality survey research, because when they do that and the big data agrees with it, then I think we have a level of certainty that we have never had before. So yeah, it's never about one study. A professor told me when I was an undergrad, one study never proves anything. So what I'm all about is, oh, I got all these studies and these are surveys and these are big data. And look, they're all pretty much agreeing. Now I feel good about it.
We have time for one last question. So I'm going to ask Romario's question, which is looking at geographical data. Have you ever worked with GIS and SAS simultaneously to communicate your findings? Is it possible to link those programs?
Yeah, well, I usually use SAS to manage my data, and then I'll ship it off into ArcGIS or whatever to do the GIS part. And frankly, it's been so long since I've done GIS stuff that I typically farm it out to a student who's taking the class and have them do it. But yeah, for me, I tend to do most of my number crunching in SAS, then I shift it on over to a geographic program, and then we can party in the geographic program and make cool maps and stuff. And I've got some papers published on that. Mark Rank and I did one on poverty where we do that a little bit. But yeah, no, all the time, big time, love it, go for it.
Any final words before it sends us off?
No, I just hope people would have fun with this. And my advice would be just mess around, see what you like, and do what's fun for you. Because if the question is fun and interesting for you, it is probably a question that other people want answered. So don't ever just say, oh, it's fun, but I'm going to do some real work. That fun part of your brain is telling you something about the importance of this that other people have been trained not to look at. So my advice is have fun, follow your whims and your spirit and what you think is interesting. And I think other people will respond to that.
Brett, thank you so much. This has been so interesting, and like Gary, now I'm interested in seeing what's out there that's relevant, that I'm making assumptions about, that I can find some data to support. So thank you so much for the talk. Gary, thank you so much for co-moderating and being my host. We did not plan today's lecture at all as an infomercial for the Brown School Summer Institute, but if you are feeling turned on about learning R, learning Python, learning GIS, we have classes that are enrolling right now, taking place next month. So that is available. Just Google Brown School Summer Institute, and there's spots remaining. We'd love to have you. So just close out by reminding you that we're back on tomorrow afternoon at 4, and still possible to register for Dr. Cabaz's program. And we'll hope to see you there or at an upcoming program soon. And in the meantime, we hope wherever you are that you stay healthy and safe, and that we catch up with you again soon. Take care, everybody. Have a good day.
Thank you, Brett.
Thanks.